Hi everyone, thanks for joining us today and welcome to the info session. My name is Ishan and I'm the Partnerships and Marketing Lead from the Center for Sustainable Medicine in NUS, and I'll be your moderator for today. And we're thrilled to have you all here today as we introduce this groundbreaking program, our Master of Science in Sustainable Healthcare, and this is actually the first of its kind in the world. So I'll go on to giving you the agenda for the day. So for today, we are beginning with Prof. Nick Watts giving a short introduction to give you the lay of the land in the field of sustainable healthcare. And then he'll be passing on the time to Dr. Amanda Zane, who will be going through more about the program structure and the career pathways that you can actually look forward to that this program gives you an edge in. And then we'll have Lydia, who is our program advisor, go through a bit more of the administrative details that you need to take note of. And lastly, we'll end off with the Q&A segment. So like I mentioned, if you at any time during the presentation, you can feel free to type in a question onto the chat box that's located at the bottom of your screen, and we'll get to them at that Q&A segment. So now I'm happy to pass the time to Prof. Nick Watts, who will give you an introduction.
Hi friends, it's really nice to be here. It's a little daunting, hey? The number of people here is overwhelming. But pretty cool, to be honest. My name is Nick. I'm a doctor, and I think my accent should reveal I'm Australian. I've worked at the sort of confluence of health and climate change for a while now with the World Health Organization, working on the negotiations to the UN Framework Convention on Climate Change, with the medical journal, The Lancet, and some of the Royal Medical Colleges up in Europe, and then with the National Health Service. I was the Chief Sustainability Officer there for the NHS in the United Kingdom. But now I've got an even cooler job, which is down here with the team that you're meeting today at the NUS Center for Sustainable Medicine. Look, I'm going to just give a pretty broad impact here. And I'm going to assume that if you've shown up onto a call like this at 7 p.m. in Singapore, you already agree with some of what we're going to say. So let's move quickly. 2009, a pretty landmark publication out from the medical journal The Lancet, the world's most prestigious medical journal. It does not make statements like this lightly. Climate change is the greatest global health threat of the 21st century. In fact, it went on to say, if you are a health professional, if you are a hospital, if you are a high quality healthcare system, you cannot, not you shouldn't, not it might be difficult, you cannot continue to provide care for your patients unless you are directly responding to climate change. The reason for that is because it turns out that the environment is everywhere. It turns out that a changing climate exacerbates air pollution. It turns out that it undermines the core foundations of good health, the food that we eat. An extra 16 million kids under the age of 5 across the region malnourished as a result of climate change. It turns out everywhere you see a vector, a mosquito, rodent, anything carrying an infectious disease, it is directly affected by thermal stress and by precipitation. Climate change changes both of those things. And so to that end, it changes that pattern. It spreads those infectious diseases. Heat, flood, storm, mass migration, the mental health impacts of climate change, infectious disease, drought. Everywhere you look, climate change is directly relevant to what it means to being a health professional in the 21st century. That's all pretty negative, though. The next slide, hopefully, gets a little bit more positive, because those exact same causal mechanisms that the Lancet was referring to back then, they actually run in reverse as well. If you went and asked anyone who works on climate change full time and you said, hey, what things do you want to do? They would say, well, listen, I'm really concerned about emissions from transport. I'm really concerned about coal, fossil fuels in the atmosphere. I think we are destroying too much of the natural environment, too much of the land. We're not using the space that we have wisely enough. And if you were a healthcare professional and you looked at the full list of everything that was being recommended there, you would, everywhere you see see health benefits out the other side. You would see physical activity coming from the transport interventions that tackles obesity directly, that tackles diabetes, that tackles heart disease, that improves mental health and well-being. You would see cleaner energy that's more secure for our critical infrastructure like our hospitals, and you would see that it directly reduces deaths from acute myocardial infarction and cerebrovascular accidents, from heart attack and stroke from air pollution. And you would see healthier diets that reduce rates of colorectal cancer, cardiomyopathy, that reduce rates of breast cancer. Everywhere you look, the response to climate change is good for public health. But it's actually a little more than that. If you go just a little bit deeper and you look into the four walls of a healthcare system, you can see that there's a lot of work that we have to do as well within our day-to-day work. In fact, we reckon that if you go and add up the total emissions of every single healthcare activity around the world, not quite 5 or 6%, as that number says, a little bit higher, 7.5%, 8% of global emissions come from the work that we do. Now, that is more than all aviation and shipping combined, and we spend a lot of time talking about aviation and shipping. If healthcare was a country, it would be the 5th largest in the world. Now, that, honestly, when I first heard that, alarmed me. I suddenly said, well, God, what are we going to do about that? But when you looked around the world, there wasn't quite the evidence out there. There wasn't quite the education, the skills to help empower health professionals to act on that. You can see some of the work that has started to come out in the pie chart there. 5 seconds ago, we didn't know what the carbon footprint of a healthcare system is. Now we're starting to get a pretty good idea, 20% in the medicines we prescribe, 10% in the medical equipment, the protective equipment, the scalpels, the x-ray machines, 20% in how we move patients and ourselves and goods around the healthcare system. The more we start to know about this, well, that knowledge we can turn into action. We've started to see that action. I remember a while ago, maybe 20 years ago, when I first started working in this space, it was a relatively new field. I remember thinking, God, this place is really going to start to take off. This field is really going to explode. We could have 5, 10, 20 jobs around the world in this at some point by the 2010s. I was wrong. Healthcare's response to climate change has grown exponentially. Everywhere you look, pharmaceutical companies, medical device companies, medical tech companies, hospitals, individual clinics, government health ministries are all realizing that if they want to continue to provide high quality care in the 21st century, well, they need to respond directly. We've done some back of the envelope calculations. You can see there, 200,000 jobs in healthcare sustainability in Southeast Asia alone by 2030, a $43 billion market. It's a pretty exciting place to be. I think it's probably the definition of a growth industry. I'm almost done. The final slide talks a little bit about us, the Center for Sustainable Medicine. If you go around the world and you say, well, who works on this? This is important. If there's 200,000 jobs out there, if the size of the market is in the billions, who knows about this? It's taken us a little while. And of course we would say this, but I'd encourage you to go and look it up for yourself. We have amassed, honestly, the world's experts from all over, all countries down. Clinicians, chemical engineers, economists, public policy experts, communications experts. It's a pretty exciting dynamic center to be. And what's cool about it is that we've got that critical mass of expertise. That means that if you have a question, we have someone in the team that has an answer. I don't think any other center anywhere in the world that I've seen has the ability and the capacity to respond to something like this at scale. You can see from the way I'm talking about this, we're pretty excited about everything that's coming. That's all you need from me, though. Amanda, she's really, really impressive as a clinician that knows what it means to, in the front lines of everyday clinical practice in a pediatrics emergency, respond to climate change directly. Amanda's going to take us through exactly what the master's program looks like. Thanks, guys.
Thanks, Nick. So I'm excited to tell you a little bit more about the master's program. Just because I know that in this call we have people joining not just from Singapore but all over the world. I really want to tell you how proud I am actually to be from NUS and, having this course cited right in the heart of Asia, where we are convening lots of different global experts for this specific program. And you get the opportunity to study right here. We are Asia's leading university. We have not just faculty who are, already in NUS, but even experts all around the region coming together. With this master's, it's really not just about either theoretical or practical skills. It's actually a blend of both, right? So, for people who are perhaps new to the healthcare field, or even those who already have some healthcare background, you will be able to get an overview of the healthcare context, so that don't feel daunted if you feel that, hey, I'm not a doctor, I'm not a pediatrician. That's okay, right? Because this course really gives you some of the foundations in healthcare, around public health, right? And you get to learn more about the interconnectedness of different factors at play, the connections between climate, environment, and health. And it's a bi-directional relationship, so how climate change impacts health and health outcomes, and also about in the other direction, right, about how health impacts climate and what we can do to modulate that as a workforce, not just in healthcare but as a society. We are also mindful that this course needs to be future ready and equip you with skills that are practical for your future career. And so this course really does have quite a bit of hands-on learning, not just at the individual level, at the group level as well. And finally, I think we have designed this master's to be really impact focused, and knowing that everybody's learning needs are different. There is some flexibility in customizing your learning journey and how this course will serve you for your future career. So just to give you an overview of what this course offers. So this is, I would say, the academic rigor associated with this course is, I think, second to none. This is a 40 credit program consisting of 4 core modules, 2 capstones, which I'll talk about a little bit more in detail later. And you have a suite, a whole buffet of electives from which you choose 4 programs. And this can be done as a full-time program over the course of 1 year, which I think is the most ideal way to take this course. Alternatively, you can do it part-time over the course of 2 years. And I think where this course is really special is in the multidisciplinary learning, right? You're not just learning how to be a specialist in one area of healthcare, but this is really something that is meant to serve you, meant to be cross-cutting and serve you wherever you go within the healthcare space upon graduation. So the outline of the course, if you take it full time, as I said, it's over the course of 1 year, semesters 1 and 2, and that kicks off in August this year. In August, you will be expected to do 3 modules, 3 of the 4 core modules there, Principles of Sustainable Healthcare Practice, Foundations in Net Zero Analytics, and the Climate, Environment, and Health module. You will also be doing the first part of your capstone and doing 1 elective. For the second semester, that takes place in January to May next year. That consists of just 1 core module, Driving and Implementing Net Zero Healthcare. You finish off the second part of your capstone, and you are also expected to do 3 electives. And I'll go through those in a little bit more detail in just a few minutes. So this is to give you some further detail about the core courses. As I mentioned, even if you don't have a background in healthcare, that's okay. We do have a module in Principles in Sustainable Healthcare Practice that also gives you some foundation around the context of healthcare, but also gives you some of the principles of sustainability applied to the healthcare setting. you will also be doing a module in Foundations of Net Zero Analytics. And this is really the quantitative and methods heavy module that we have to help you gain the tools to figure out how to count carbon well, right? And this is, as I think what was alluded to earlier on, is what we term as carbon footprinting, and that's done via a method called life cycle assessment. And here, it's not just going to be a textbook exercise, but you will get the opportunity to learn hands-on how to actually do a life cycle assessment with the support of excellent faculty who will guide you along. And this is an opportunity for you to get some inspiration for your capstone project, if that's the direction that you want to take that in, to, you know, really have a really good attempt at doing a carbon footprint of something in healthcare that no one else has done before. You get to work with the Center for Sustainable Medicine, and hopefully, you know, this if this is something that you want to pursue beyond the masters, you want to take it further up, there is that option for you there too. You also get to do a module on climate, environment, and health, and this is really painting the broad context of the relationships between climate change and health, learning about how different geographical regions, for example, are vulnerable to the impacts of climate change in a health dimension, right? And how countries are supposed to adapt to that, where the gaps are, and you get to learn a bit of epidemiology, climate science as well. And finally, on the last module, this is I would say the most action-focused, the most practical aspect of our course here, where you will gain the tools, the frameworks to navigate the very complex health system, not just in your clinic or in your hospital, but even at a national, regional level, an international level, wherever that you subsequently want to apply yourself to. I think this will be helpful for you to implement either projects at a local or community level, or even influencing policy at the national or international level. And I think finally, I mentioned a little bit about the capstone project. I won't speak further about that. Yeah. This is the full suite of electives you get to choose from. So you can see that depending on where you feel your learning gaps are, you have the flexibility to take up courses in hospital leadership, for example, clinical decision support systems, healthcare operations, healthcare systems, around program evaluation and implementation, public health policy. And if you come from, say, for example, a more health background, and you find yourself wanting to reach out for more knowledge and skills in the climate science space and sustainability space, we have those options for you from across the university, whether it's in the built environment space or whether it's in the energy space. And if you are more research oriented and you're really thinking of stacking on, thinking about a PhD after this, then that's where you might want to also take up some of the electives in research methodologies, especially in epidemiology and in public health. And I think I hope I would have emphasized this enough by now, but the flexibility attached to this program really means that you have quite a broad, open suite of different career pathways here, whether it's in clinical leadership and hospital management, whether you're more research inclined and in the health sciences, whether you would like to join industry, for example, in medtech and pharma, or even at the policy level, in either at the national level or even at the international level. And finally, even at the operational level, I think we find that the operational arm of the Army of Sustainable Healthcare is really important to drive change. So you will find many options for you upon graduation where you can actually apply the skills learned from this master's course. I am really pleased to show you just a quick taster of the kind of faculty that we have in our program. These are distinguished faculty that come from very diverse backgrounds. They themselves are real world practitioners with already making impact all around the world in wherever they are. And they have committed to supporting your learning journey, and you'll get the opportunity to learn from them. So whether or not it's, for example, we have people who are in in the sustainability space working in policy. We also have people who are specifically doing research, for example, in low carbon healthcare. We have people who are in the private sector who are, chief sustainability officers, even in public health systems, chief sustainability officers. And we also have policy and public health professionals all around the world to contribute to this program. And with that, I'm going to pass time over to Lydia, who's going to tell you a little bit more about the admissions and application process.
Thanks, Amanda. Hey, everyone. So just a couple of details to note with your admissions and application. So the semester 1 kicks off in August, early August, and that starts with your orientation week. And classes will begin on 11th August. And in terms of admissions, in terms of if you're thinking like, oh, maybe I don't come from a healthcare background, we do highly encourage if you are in any healthcare related field. So if you're studying medicine, nursing, public health, sustainability, and environmental science, we certainly encourage you to apply. And don't worry if you don't have any healthcare or sustainability related like knowledge. We welcome like people from business and engineering, finance, and economics to apply as well. And just note that if your undergraduate studies was not in English, you do have to submit a valid TOEFL or IELTS score to show your proficiency in English. And the cutoff scores for those respectively are 6 for IELTS, and for the internet-based TOEFL, it's 85. And just to note that your test score does have to be, the test date, it has to be 2 years from that. We will require you to submit your degree certificate and transcripts, as well as to do a little write-up. Doesn't have to be really long, just a statement of purpose to tell us like why you're interested in the program or what sparked your interest, and also your resume. So just a few tips. If you have any like awards or certificates that maybe you did like a little online course in sustainability, do feel free to attach that in your application. And in your personal statement, if you could highlight what drew you to our program and maybe what interests you in this field to work as. And just a note that applications are closing in about 2 to 3 weeks on 7th March. So if you do want to, if you maybe haven't looked at your application in a while, you started one, we do encourage that you complete your submission. And next slide, please. So just to let you know, the course is $54,000, excluding GST. And good news, if you're a Singapore citizen or permanent resident and you have SkillsFuture credit, those that are 25 and above, you would have received $500 opening credit. That doesn't expire. And if you were 25 years old or above by the end of 2020, then you would have received an additional $500. So that does expire at the end of this year. So that's, that's all I had for my section. So I will hand it back to Eshawn to take us through Q&A.
Thanks, Lydia, Prof. Nick, and Dr. Amanda as well for giving us all that insight. So now we'll move on to the Q&A questions. I do see there are some questions coming in. If you are unable to find the Q&A tab, actually, I noticed that some people are asking as well. You can click the 3 dots that say more, and then you might find it there as well. It's a question box that says Q&A, and you can submit your questions there. And yeah, we've seen quite a number of people asking questions already, and we're quite encouraged, I would say, that this is actually our second info session being run, but there's been a very overwhelming response as well, and we do see that a lot of you have attended and want to know more. And I do see that this particular question comes up at every one of our sessions, and even people emailing to ask, which is what's the difference between this master's program, and we do have an executive fellowship program, and whether you can take an online version of this program. So thankfully, when we were thinking of the education needs, we did think about how we can get the best reach as well. So maybe I can direct this question to Dr. Amanda to take us through, what you get out of each of the different courses.
Yeah, so with the master's program, it's all in person. There isn't going to be if you wanted to pursue something that was remote, then you might want to think about the executive fellowship. With the master's program, I think the way it's been designed is really most beneficial. I think you get the most out of it when you pursue it as a full-time master's that you finish in a year. In terms of what other differences there are, so I think of course the coursework for the masters is significantly heavier, and with the masters you also have the requirement to do electives and to do a capstone project. With the executive fellowship there isn't a capstone project, and of course with the master's program, because it's in person, I think what you do get is actually to the opportunity to network with all your fellow batchmates who are in the same course with you. Yeah, I think that is probably the short answer. Maybe it might be helpful to go back to the slides just to recap in terms of the other structural differences between the two programs. Yep. So so as I mentioned, you have 4 core courses and you have 2 capstones, which is basically over the course of the entire year, and 4 electives to do. And these are the 4 modules that we spoke about. Those are the core, and then the suite of electives, really just to help to supplement your learning, to give you a more all-rounded learning.
Thanks, Dr. Amanda. I think while we are on this slide, it's great to answer this other question that we have as well, which is how part-time classes will actually be conducted. And because on this slide, what you see at the bottom on semester 1 and semester 2 has actually been split up according to the full-time course. So if I can direct this to Lydia to take us through a bit more about how, if you were to take this part-time, what the difference would be.
Sure. So with the part-time workload, it's more that you have 2 years, up to 2 years to finish this master's. So classes are conducted mostly 9 to 5 in the day and not necessarily in the evening. And some courses may be conducted intensively in like just a few weeks instead of the entire semester of 13 weeks. So with a part-time candidature, so what you see here on the screen is the workload for full-time, but how it looks for part-time is that you would spend your first year doing your core courses, so the 5001 to 5004, and you would do 1 elective in that first year in semester 2. And then in second year, you would mainly spend it completing the capstone, so 5,101 and 5,102, and then you would make up the remaining 3 elective courses. And whether you want to do like 2 elective courses in second year, semester 1 or semester 2, that's up to you to choose your units. Yeah.
Okay, thanks, Lydia. Yeah, I think those were pretty technical, heavy questions, but I do see one question that is a bit more personal and perhaps asking about the experience of how do you balance patient care while pushing for more sustainable practices, and what has been the challenges that maybe you have experienced? If I can direct this to either Dr. Amanda or Prof. Nick, if anyone want to chime in.
The challenges are quite universal across, I think, speaking to lots of other healthcare professionals who are engaged in the same pursuit. There is a question of awareness, right? And that's where I think education is a really big piece here. It's a cornerstone to getting us to the point where we can really drive change. And that's why I believe so much in this program, because it really does help to build that core group of people with expertise, right? For the most part, people who are not necessarily practicing towards, in sustainable healthcare have a far less in-depth understanding. But when it comes to actually wanting to do something, right, inevitably people look to you with all the answers, all the way from, what is the carbon footprint of this syringe, down to, can you explain to me the climate science behind this, something potentially relatively far removed from clinical practice. So I think those are some of the early challenges that I had faced. Education, so therefore I think is a big solution to that. The second thing is also in communication. Oftentimes, and this is an ongoing thing, right? Where it's an ongoing learning journey where sometimes we find it difficult to express ourselves, to express complex ideas or ideas that are foreign to a group of professionals. Say, for example, talking about climate change to a healthcare professional can sometimes be quite daunting when you yourself were maybe not, a climate scientist yourself, right? But that's where I think, of course, practice is helpful. And the second thing is also being able to equip yourself with the skills in climate communication, or even communicating whatever ideas that you have around driving sustainable healthcare projects across. And lastly, I think there is a question around navigation of systems, right? Having been a healthcare professional for some years now, I can tell you that the healthcare system is complex. You can be a sustainability professional and you can come into healthcare completely lost, not knowing where to start. You can be a healthcare professional having been practicing in clinical medicine or, in healthcare operations for that matter, for years, right? And suddenly you are thrown with this task of driving some sort of sustainable healthcare initiative or, passing this policy in sustainability. And oftentimes, you don't know how exactly to navigate the complex web to do this thing that, decades ago we didn't really need to do. So yeah, I think that those are going to be the 3 main sort of challenges I see. And moving forwards, I think that the master's program does a good job in helping you to upskill in those areas. And I hope that it will be practical, and not just for, the healthcare professional on the ground, right? I'm just speaking from the position of actually being in healthcare, in a healthcare system. But healthcare is very varied. So we have people who are in pharma, for example, and those people are very important for helping us to decarbonize supply chains. We have people in public health who are very important in communicating the links between climate change and health, and then also passing policies that make sense, that work and translate on the ground to the common man. Yeah, and finally, I think that there's a lot that we still don't know. There's a lot of new knowledge to be created, and that's where I think research is really important. And so this course also helps to build the foundation for that, if you're inclined that way.
Thanks, Dr. Amanda. Yeah, I see a couple of questions that are coming in from people who are anxious to know whether their background would be actually relevant to this course. There are people who are asking from an environmental science background, business backgrounds, even someone who's been in an investment company previously. They're asking more about, how have their past experiences apply to, in terms of how their applications will be received by us. Perhaps I can direct this to Prof. Nick.
Sure. The applications are received with excitement and great delight. I used to run a fairly large team in the NHS, about 150 core, but out in the sort of full world, there were about 1,200 of us working on the response to climate change for an entire national healthcare system. When you looked around that team, there were a couple of doctors, there were nurses, there were physiotherapists, there were pharmacists, there were health economists, there were people with a business background, investment experts, who were pretty good at securing some of the best power purchase agreements to put solar panels up on top of the hospitals and make sure we had a good return on investment that we could invest back into clinical care. We needed people who were pretty clever at manipulating some of those matrix tables to help us figure out and convert some of the spend data that we had into carbon data. So we needed engineers, environmental scientists. We needed public health experts who were able to scan out into the horizon, use some of those clever epidemiological methods, and climate scientists who could look at some of the climate projections out to know what we as a healthcare system were going to be facing in the future and what we had to respond to. The team was, by its nature, multidisciplinary, because by its nature, the response to climate change is multidisciplinary. And when you're dealing with something as big and complex as a healthcare system, you need absolutely everyone. So we've designed this course with that in mind. No one is advantaged or disadvantaged by the background that they come from. In fact, we are all benefiting from each other. We're all benefiting from what we learn by talking to the person from a completely different discipline to our left and to our right.
Thanks, Prof. Nick. And I also see a couple of people who are asking from an undergrad perspective, or people who are just graduating, on whether they can apply and what kind of certification would be needed in terms of is it okay to apply with certification that is coming in earlier and where the degree is not fully finalized or will only be finalized at a later date after applications close. Maybe I can direct this to Lydia, who's been going through our applications.
Thanks, Sean. So you are able to submit your application even if you haven't graduated, because I understand that some of you only graduate and get your certificate in like May, June. So you can submit the transcript that you have right now. And some universities do also give you a verification certificate to say that, you're enrolled at this university in this program and you're expected to graduate on this day. So if you can get one of those from your uni, do attach that with your application as well. So don't worry if you don't get it yet. We will, after you do get your certificate, you can then send us the completed like degree and transcript, and that's okay too. Thanks.
Thanks, Lydia. And there are people wanting to know a little bit more about the capstone project as well. Maybe I can direct that to Dr. Amanda to flesh it out a little more for those that are asking.
Yeah, so I think this is going to be something that you will develop along the way as you go through your courses. And the idea, it's actually quite you do have some flexibility here in discussion with your supervisor. We would like to think that where some of the interest is going to be in, for example, just to give you some inspiration here, is that some of you may want to actually pursue a life cycle assessment, a carbon footprint of a specific thing that you are interested in that is related to healthcare. And you will realize that, that's why there is a whole module that's dedicated to that. And you will realize that, that it's actually quite complex, and but not to worry, I think you will get the support that you need to get through that. Yeah, otherwise, that there is honestly quite a lot of flexibility here, in terms of what kind of project that you would like to pursue. Nick, would you like to chime in, or Ronghui chime in on this?
Sure. So it's a full year 2-module project. At the end of it, Amanda's entirely right. The outputs are flexible. At an absolute minimum, what we need to see is a proper report and write-up of all of the work that you've been doing. It's a full year, so expect it to be a challenging project. But you would be paired with an academic supervisor, and depending on the interest, some of the projects attached there would pair you with a clinician, would pair you with a part of the healthcare system in Singapore, which, as Amanda said, is really the beating heart of sort of innovation in healthcare. And you'd come out the other side with, we think, something that would absolutely be publishable in an academic journal. This is the footprint of something that we really didn't know before in healthcare. It is new thinking on how a healthcare system should adapt, should respond to the threats that they're facing, whether it's heat, whether it's flood, whether it's the spread of infectious disease. You get the sense that there's a fair bit of flexibility, a fair bit of support, but also that this is a pretty ambitious and challenging capstone project.
Thanks, both. We'll be going to the next question right now, which is that people are asking about, how will employment look like after the masters, and what kind of, networking opportunities that they can get out of this program to kind of assure them that, there will be a recruitment for them at the end of this course. Maybe I can get Prof. Nick or Dr. Amanda to chime in a bit on the networking opportunities that are available.
Sure. So I already started this, and then Amanda talked about the faculty we have involved in the program. We have the very, very, very best. We would say that, obviously, but go look it up. I reckon we might be right. People from PwC, from the Lancet, from the World Health Organization, from the Asian Development Bank, all involved in providing that expert knowledge to you as people taking the course. That's pretty cool, and the opportunity to get to know some of those people at the very front of their field is a really great head start into a career in this space. If the other half of the question is, well, what about the jobs out the other side? Think about it this way. Healthcare is big. We are 10, 15% of global GDP. We are enormous. In any one city, a hospital is almost always going to be the largest employer. We employ thousands and thousands of people. We are often multi-billion-dollar organizations. Some of the biggest companies in the world, AstraZeneca, Johnson & Johnson, Pfizer, they are pharmaceutical companies, they are medical device companies. You get the point. Every single part of the healthcare system, of that value chain, from the nurse out in community to the multinational pharmaceutical company, is today responding to climate change. They are thinking of different ways that they can align their drugs with new green chemistry techniques. They are thinking about how they can make their devices more circular, how we can provide digital care closer to patients in community. We are thinking about how we orientate the future of what a hospital actually is, what a new hospital needs to be so that it can be better for our patients, but also lower carbon. And every single one of those transitions and every single one of those companies and every single part of the healthcare value chain needs someone that knows what they're talking about. It needs someone that can do all of the things that Amanda has been talking through. Honestly, I said it already. I think this is the definition of a growth industry. We've seen it explode in the last 10 years or so. I see no sign of it slowing down.
Okay, thanks very much. And thank you so much, everyone, for joining us today. And if anybody has any last questions, but before I get to that, just a gentle reminder that applications are actually closing soon on 7th March 2025. So we've actually been very encouraged by the applications that have been coming in, and we do accept them on a rolling basis. So I do encourage you to send yours in as soon as possible. And also, to stay up to date with us, please do follow us on our social media channels that you can see up on the screen, and later on we'll also flash the QR code that has a link tree to all that's very easy for you to scan. Yeah, but that's all from my side. If anybody has any closing words for us.
I don't have too much other than to repeat some of what has already been said. Hey, we started with a quote from The Lancet in 2009. Climate change is the greatest global health threat of the 21st century. This is a pretty rapidly emerging field. And if it is really the greatest global health threat, if this really is an emergency, then what you need is the health profession and all of its allies in engineering and public policy and economics to start to treat it as one. That kinda is what this master's program is all about. It provides the networks, the skills, it provides the excitement and the energy. You can see that we're pretty excited about this to get out there and respond to that crisis. Nothing short of changing the world, changing the future of what it means to be a healthcare system. We're pretty excited to meet you guys, and we hope that we get to do that soon. We look forward to reading your applications, and otherwise, I hope everyone has a really great evening.
Thank you so much for your time, and we'll be closing the session here. Thank you.